Diagnosis of and poison. The diagnosis of and poison, it is an important not only for the therapeutic purposes but also for the legal aspect. The fast investigations regarding to the identification, dosage and the route of administration of and poison helps for the better application of the therapeutic measures. Saving the patient life, the physicians is the primary concern. Additionally, the purpose of and poisoning, whether accidental, suicidal, homicidal, should be investigated. The diagnosis of and poisoning into the livings. The poisoning into the living can be individualized or the large group. Mass poisoning can be induced through the liquor, drugs, meals, drinks and etc., in which all the victims show the similar symptoms. First, acute poisoning. Manifestation of and the signs and the symptoms within a short term or the short time and attains the complete features. The general symptoms of an acute poisoning are the vomiting, diarrhea, convulsions, fatigue, acute coli, borborygmi, and excessive salivation, deformed pupil, buzzing into the air, hyperthermia, sweating, delirium, neurological symptoms, bluish discoloration, anxiety, respiratory distress, coldness of and body parts, and restlessness. These are the symptoms of we can see into the acute poisoning. Then the chronic poisoning. The signs and the symptoms develops gradually and at time remains concealed. Sometimes the course of and chronic poisoning is so slow that the signs and symptoms represent themselves very mildly as the symptoms of and other diseases. Due to the mildness and the diagnosis of and chronic poisoning is completely missed. The common symptoms of and chronic poisoning are restlessness, anxiety, weakness, loss of and weight, on and off presentation of and gastrointestinal symptoms. Diagnosis of and poisoning into the dead. Diagnosis of and poisoning into the dead is done by the following four measures: postmortem examination, chemical analysis, experimental experiments on the animals, and the mortal and the circumstantial evidences. The postmortem examination will be the external and the internal examination. Seventh point, the general principles of treatment. That is the resuscitation, which includes the revival, maintenance of and cardiac activity and the blood circulation. The oral and the oropharyngeal secretion should be removed by the suction. In case of a respiratory failure, artificial respiration should be adopted, and the ventilation. Any crowd of and people should be removed. The room should be well ventilated. The clothes of and patient should be loosened. The artificial and the supportive respiratory measures should be taken. Treatment: hypotension. If the systolic blood pressure falls below the 99 mm of Hg, then the physician should immediately arrange for the artificial respiratory measures, the head low position of and patient, and dopamine injection to enhance the renal blood flow is required. Then second is the removal of an unabsorbed poison. The rate of an absorption of an poison depends upon the nature and the route of an administration, as we seen before also. The poison should be removed before it get absorbed completely, or at least the absorption process should be slowed down. The removal of an unabsorbed poison will be like the contact poisons, inhalated poisons, and injected poisons and ingested poisons. In contact poisons, wash the area with the clean water and use the antidote if the poison is known. In inhalated poisons, shifting the poison to fresh the air and sufficient ventilation and artificial respiration is given. Then in injected poisons, the application of an tourniquet near the site of an injection, application of an ice packs and incision and the suction. Ingested poisons, indication of an vomiting and the gastric lavage is done. Indication of and vomiting. Indicated during the initial few 5 to 6 hours of an ingestion of an poison. The contraindicated in the case of and corrosive poisons and the unconsciousness and the children and the pregnancy. Commonly used emitting drug agents are ipecac powder 1 to 2 gram into the 1 glass of water and ipecac syrup, it is 30 ml, and zinc sulfate 1 to 2 gram into the 1 glass of water and ammonium carbonate 1 to 2 gram into the 1 glass of water is given. The gastric lavage or the stomach wash. Gastric lavage is the washing away of an upper part of an gastric tract and the removal of an ingested poisons. Gastric lavage tube or the Bose tube or the Ewald's tube. It is the rubber tube, length of 1 to 1.5 meter and breadth of 12.7 mm. For children, Ryle's tube is used. Indicated into the ingested poison. The contraindications in case of the corrosive poisons and convulsions, comatose patients and upper alimentary tract illness. If the considerable time has not lapsed in case of an ingested poison, then induction of and vomiting proves more productive than the gastric lavage as the first line of under treatment. However, even if the patient have vomited, stomach wash should be performed to wash out of under traces the poisons that may be still present into the gastric cavity. Third one is the antidote. Antidotes are the substances that are counteract or the neutralize the effect of and poisons. Types: mechanical, physical, chemical, physiological and universal. In universal antidote, the charcoal plus magnesium oxide plus tannic acid is taken into the 2:1:1 proportion. 2:1:1 proportion is the universal antidote ratio. Then elimination of and absorbed poisons. If more than the 6 hours has passed from the time of and poisoning and other countermeasures has not been proven efficient, then it should be understood that the large amount of and poison has been absorbed already. This poison should be removed through the diuresis and the sedation. Treatment of and symptoms and the other complications. The systemic treatment also plays the vital role into the management of and poisoning in case of whereas the source of and poison is not established. Only the basic symptoms should be treated, like the pain should be treated by the analgesics, morphine and pethidine. And paraxia is treated by the antipyretics such as ibuprofen. The respiratory failure, it should be treated by the artificial respiration and oxygen therapy. The fall of and BP should be treated by the cardio stimulants. The fall of and temperature should be treated by the non-pharmaceutical measures such as the warm room and the blankets and etc. The convulsions should be treated by the barbiturates, and the dehydration should be treated by the fluids and the for fluids and the ORT. The maintenance of and the general health of a patient. The body temperature, functioning of and vital organs, strength, consciousness should be assessed at the regular intervals. Counseling for the optimum recovery of a patient after the poisoning. In case of a suicidal poisoning, after the recovering from the poisoning, the patient should be consulted with the psychological and the medical support should be given. Sixth one, it is a maintenance of and general health of and patient. The body temperature, functioning of and vital organs, strength, consciousness should be assured at the regular interval. The counseling for the optimum recovery of and patient after the poisoning. In case of and suicidal poisoning, after the recovery from the poison, the patient should be consult and consult the psychological and the medical support should be given. The duties. 8 point, duties of a medical practitioner in case of a suspected poisoning. The prompt diagnosis of a poison should be done. Care and the treatment of a patient. In case of a doubt, the physician should stick to the general line of a treatment and manage the patient symptomatically. Then taking care of and legal proceedings, the physician should not be name, address, sex, age, occupation, date, time, and arrival, and accompanying the members of and the common history of and patients. In case of a dying patient, the dying declaration should be noted immediately. In case of a sudden or the accidental poisoning, if the physician feels that there can be the mass poisoning, then he should promptly inform the concerned authorities about the same. In case of an suspected homicidal poisoning, the physician should immediately consult and the expert toxicologist or the pharmacological science experts. On the confirmation of an homicidal poisoning, the physician should inform the police and other concerned authorities. The physician the patient should be immediately removed from the local of the poisoning and the location of the poisoning. Yeah. The patient should be immediately removed from the location of and poisoning, and it's always judicious to admit him into the hospital. All the documents and evidences carefully preserved. The gastric content, vomits, fecal matter, blood samples, etc. should be stored into the container and appropriately labeled. If the patient dies, the death certificate must not be issued. In case of and poisoning, the medical officer of and government and the public hospital should be immediately informed and the legal authorities. Thanks, guys.